Hello, my name is Alex Onyedichin. We're just going to talk about healthcare language and care planning, how to write care plan as a support care worker. So, if you are new to the UK or you are new to the health and social care job, it's very important you understand when we talk about documentation, the role of a care support worker. Today, we're going to base it on those who work in the mental health hospital, mental health care home, nursing home, and even community. So first, we're going to quickly run through most common languages when we look at English language in a care home or mental health home. So some of the language we're going to be saying that are common, which will also be part of your documentation when you are doing your care plan, when you are doing your note writing. Is maybe asleep, someone who is asleep. So now when you say someone is asleep, you need to make sure you have counted the person respiration. So to count the person respiration is about counting 60 seconds. How many times the person breathes between that 60 seconds. So now, normal respiration rate is between 12 to 20 or 21. I will focus on 12 to 20. So, say for example, the time is counting 1, 2, then you're counting. The person, that's 1, then that's 2, until you get to 60. Except you are a doctor or expert in mathematics when it comes to respiratory rates counting. You can count how much, maybe 10 times how many, or 15 times how many, or 7 times how many you can count. However, I will advise as a support care worker, before you write anything down that someone is asleep, make sure they are breathing. Also, when you say someone is awake, always make sure this person moved and the person is alert. The person can see you, hear you, or the person respond as someone who is breathing and the person is stable. So you cannot expect someone is unaware and the person is feeling pain, crying, or the person is feeling dizzy, or the person is sedated and saying the person is awake, then you just leave the person there. No, you should be able to explain the person is awake, reading in his room, or doing 1 or 2 things. Does it make sense? So,
yes, sir.
Again, when you say someone is breathing, breathing should also be as when you say someone is asleep. So someone who is breathing, you should be able to find out the person respiration rate as well. You can count it. So if someone is awake, breathing, or asleep, you must count the respiratory rate. So the most difficult part, which many support workers like writing, the most common language they use is appears asleep.
Appears asleep.
Appears asleep. So we say appear to be asleep. Appears asleep. So now, this is not a good language when someone is supposed to be in hourly or intermittent observation. So intermittent observation can be 15, 30 minutes or every 10 minutes, depending on the risk involved. So it's always very important you state if the person is awake rather than appears asleep, or asleep rather than appears asleep. So always avoid using the word appears asleep.
Sir.
I like using the word if someone is awake or the person is nearly sleeping. I'll say sleepy. Sleepy. So someone who is sleepy can actually maybe looking sedated or looking tired or looking nearly falling asleep. So at the same time, I always write respiratory rates at the end when I say patient sleepy. Yeah.
Okay.
Patient appears sleepy. Then I'll put respiration rate there. That's normal. We'll see that. Yeah.
Okay.
So now another one is talking. If someone is talking, you should be able to explain what they are saying. Are they having insights? Do they have good
Okay.
communication to what they are saying? Do they have good understanding to what they are saying? You can ask them, where are we now? What hospital? What is the hospital name? Or
Okay.
do you know me? Do you know who I am?
Come out first. Okay.
What is your name? Can you remind me of your name or something? Just kind of
Mm.
have basic conversation that you think that is comfortable for you to say. So now,
Okay.
when we talk about commonly used words and documentation, is about what you can read, what you can write, and what you can spell, and something you are really sure. Because whatever you put down, even if the person died, it can be used against you between 1 to 25 years. You can imagine that. So it's always very important, anything you've written down, it is as good as not writing anything down rather than you write something that is unusual down. So make sure you check the patient is talking, standing, or whatever, good orientation, someone who's aware of their environment, who are aware of their room, the hospital they are, who knows who you are, who talks about what they need, or who is able to come down from bedroom to their lounge. They should be able to be identified as someone who's having good orientation. Again, food and fluid. Always make sure you are aware that they had something. If someone told you that patient had a drink or has some food, make sure you put the person name down. That this person told the patient had so and so amount of food and fluid. So if somebody is mentally stable, the same thing. Make sure you are aware that this person is mentally stable. It also helps people to understand what you are putting down. So now let's go straight to example of care notes. When we talk about example of care notes, one of the things you need to think in your head is psychosocial. You think psychosocial when you're looking after your patient. So at the end of the day, you should be able to tally with this example you can see on the screen. So first, their mental health. Has the person been mentally stable during your shift? Has the person been aggressive, or has the person been okay, settled, and the person is engaging, having good orientation? So now, these are where you can document their mental health, things about their mental health. So the second part is physical health. Has the person have food to eat? Was the person physically stable? Was the person having pain or no pain? Was the person able to communicate to you? You know, was the person able to have, able to use their walking or physical aid that they use in moving about? These are the things you will need to document when we talk about physical health. So now, the most important part is their food and fluid. Were they able to have their food and completed? How much do they add? So these are things you also need to put down when we talk about physical health. So again, let's go to communication. You should be able to write something about their communication, your patient communication. Were they able to communicate with anybody? Did they receive phone call from family? Did you make any phone call to the GP for them? Did you spend time engaging with them, maybe when you were playing with them in regard to any information the doctors told them, or they told you what the doctor said, or their friend came to visit, or they actually engage in some of there are some mental health patients that do some evidence-based education. Do they engage in any therapeutic education awareness program? Did you do card play or whatever? So when we talk about communication, these are actually things that relate to numbers, information, friendship, social, and all that. You should be able to put something down in regard to communication. Again, let's look at the other side of it when we talk about friends and family. Did anybody visit today? Did any friend visit? Did you receive phone call from them? The same thing, you should be able to engage with your patient, find out if they need to make phone call. So friends and family, again, can also engage in communication. When we look at your relationship with the patient throughout the day, look at your psychosocial engagement with patient. Were they compliant with medication? Did you call them to come downstairs or go upstairs or do anything? Or did they leave their room? Did you ask them to come to the lounge? Did you take them on Section 17 leave? So these are things you need to document down to be able to ascertain whatever relates to communication in regard to their day-to-day activity. So the last bit of it is care plan. So when we talk about care plan, you need to actually check if there's been any changes in your shift, during your shift. You will need to speak to nurse in charge, speak to anybody on duty, say, was there any change today for this patient? So that at the end of the day, you will be able to explain to whoever is on duty that, oh, look at the change in care plan, or document it on their notes. The notes you're actually writing, document it there. Make sure you put the change. If there has been no change during your shift, just make it clear. No care plan changes at the time of these notes. So it's difficult when you put no care plan change for the day or no care plan change during the shift, because you don't know if someone else did the change or they've documented it on their own notes. So it's always very important you talk about your own notes. So now, to recap, when we talk about language, most commonly used words and documentation in the health and social care, mostly in mental health. So we look at most commonly words that we see when we talk of patients asleep, awake, breathing, appears asleep, talking, standing, good orientation, food and fluid, eating, hard, mentally stable, physically stable, hard food, or food and fluid, family visit. So we now go straight to look at example of care notes. So I said, in the example of care notes, you need to think psychosocial. So thinking psychosocial kind of give you a bigger picture of your patients. What happened between their head to toes? What have you managed to offer them during your shift? Were they stable? Were they, did they have food to eat? What was the communication you engaged with? Did they engage in any activity? So again, we start by putting down on the red part of it. You can look at the red subheading between this note. You just have to say what happened between the mental health, what happened between the physical health, what happened between the communication, friends and family. The last one was care plan. So on the mental health, was the person mentally stable? That's where you need to write it. Was the person aggressive? Was the person settled? Was the person able to communicate effectively? Was the person increase the risk? Maybe the person was on section, the section was taken away, section 17 was taken away, or the person was on eyesight and the eyesight was taken away, or the person was on level 1, level 2, level 3, or level 4, different level of observation. Was those observations taken away during your shift? So this is where you need to document it on, so that whoever is starting the shift will understand the risk of that patient that they are going to work with. If you don't actually verbally communicate with anybody, but what you have documented down will support anybody who is going to manage that patient. after you have gone home. So again, the physical health, we also need to look at the person have food. So physical health is about food and fluid. Was the person also having pain? Was the person able to communicate to you, say anything in regard to physical health? Was the person having stable mood? Was the person having issue with maybe the person fall down? You know, so now when you document it, make sure you put at the time of writing this note. These are all you observe. Does it make sense? So,
yes, sir.
At the time of writing this note. So it's always very important. So the communication part of it is involving everything again. You're going to it's like when you talk about a review of everything you have written down. So the communication part should be about at the start of your shift, the patient was in bedroom and the patient was awake so and so time. And the patient came down to have this food so and so time. The patient had breakfast, had lunch, had dinner, if it was a long day shift. So those are the basic information, everything that happened on the communication part. So now, if you take the patient out, you also need to document it between the communication part of it.
Okay.
So the kind of the basic things that happen. It's not like you don't have to be a good English writer. You don't have to be the person who spell more. No, there's nothing like vocabulary, big vocabulary. Use the simple language so that when you put it down, another person starting the shift will be able to see what you have written down and is clear and is understandable, you know?
Okay.
And when you are using pen, we always advise people to use black pen. Because if you use any other color, it might not be able to photocopy it. When they photocopy, it won't be clear as black pen.
Okay, sir.
Again, the friends and family, that's where you're going to talk about if they receive friends, if people come for visit, or they receive phone call, or you saw them talking to their family on the phone, or there was some doctor communication, you help them to book an appointment. So friends and family can also be a way of talking about anything communication in regard to phone calls, visitor, going out, coming back, you know. These are where you also document it, just maybe 2 or 3 sentences. Maybe Mr. John mom came today, or John received phone call from family. But you don't have to detail what the patient was discussing on the phone, because that's not your business. Except the patient is aggressive. So whatever happened on the phone, if it's related to that aggression, make sure you document it. Make sure you let the doctor know. But if it's a private conversation, you don't have to discuss it. That's not your business. It's about protecting their private conversation. So anything that is risky, that increase the risk of that patient not getting mentally well, you have to document it.
Okay, sir.
Or anything that seems not right, anything that is not right at all to you. It might be right to me, but it's not right to you. So you have to document it so that other person can see your view about what you saw. Does it make sense? So now the last part of it, we talk about care plan. Care plan, in general, when we talk about care plan, is going to talk about if there was any changes during your shift. Maybe, for example, if it was on section 2, they now changed from section 2 to section 3. So you need to talk about that on the care plan. If the patient was on observation before and they removed the person from 1-to-1 observation, you need to talk about that on the care plan. So if there was updates or someone's supposed to update the care plan tomorrow, you can also see no care plan changes at the time of this shift or at the time of the note. However, updates is needed for tomorrow. You know, care plan needs to be updated for tomorrow or is due for update tomorrow. So just basic English. In general, working in health and social care You do not have to earn a degree. You do not have to have any education to work in health and social care. It's about, let me use the word British value if you are working in the UK. If you are working in Nigeria, it's about Nigerian values. If you are working in Canada, it's about Canadian values. If you're working in America, it's about American values. So what are basic British values? If you ask me, is about caring, tolerance, accepting individual the way they are, promoting compassionate caring, and also respecting people's privacy. So these are basic things that when you look at 6 C's in health and social care, it covers everything when it comes to working in health and social care. So documentation and care planning are the vital part of care in the health and social care. So if you are going to be the best care worker, it is good you use this format that is on the screen now.
Okay, sir.
Yeah, so don't just copy everything here. You can actually use your own words. But when we look at the meta head, you can copy those ones, put them down, then you write everything that is attaining between these notes that we have put it down today. Any question?
No questions, sir.
Thank you very much. This thing is gonna be shared, is recorded. So I'll share you on the Student Union page. So whenever we send you to go and work or we accept you either on care worker visa, we expect people to watch this video again and again and again. One of the things that we are making this video about is just to support people not to get into trouble in their daily care. Because majority of people get into trouble. When we look at Mental Health Act 1983, updated 2007. So majority of people have been to prison in regard to documentation. Some have been to prison in regard to care plan, wrong care plan. Some have been to prison even you might document the thing today. In the next 20, 25 years, they are still going to talk about it. So whatever you put down is going to be used against you. Especially when we talk about respiration. You need to know how to check patient respiration. It's very important. Let's call it a day. Thank you very much.
I'm grateful, sir.
Yeah, no problem. I'll try my best to share this video to the group so you can watch it.
Okay, sir.
So thank you very much.
Sir, your name again?
My name is Alex Oniedike. Yeah, you can.
Mr. Alex.
Yeah.
Alex Oniedike.